Chris Berger, Vice President of Programming for the League of Women Voters of Greater Pittsburgh. I'd like to thank everyone for joining us for this important panel discussion on gun safety and gun violence in PA. Before I introduce our speakers, I just want to recognize the events of today, because I know it's weighing on a lot of our minds with the invasion of a sovereign democratic country of Ukraine. As the League of Women Voters, of course, our fight is for democracy, and our hearts and minds are with the Ukrainian people this evening. We have a wonderful panel tonight, and after each panelist speaks, we'll have a question and answer session. I have gathered questions that have been submitted previously upon registration, but always remember, you can put a question that comes up during the discussion in the chat, and we will address your questions at the end. Our panel this evening consists of League of Women Voters of Pittsburgh's Nancy Naragon, UPMC's Crisis Resolve Services Medical Director, Dr. Rozel, and Moms Demand Action, Hadley Haas. We're going to begin with Nancy Naragon, who grew up in Southern New Jersey, graduated from Westtown Friends School in PA, and got an AB in Political Science from Oberlin College in Ohio, and an MSLS from Case Western University in Cleveland. She's married to Don Naragon, and they have 2 married children and 3 grandsons living in Pittsburgh. Nancy has been in Pittsburgh since 1985 and has been an active member of our league ever since. She is currently the Vice President of Development and Chair of Gun Safety. Welcome, Nancy.
Thank you. Democracy is all about community. Our local home communities, the larger community of each state, and the comprehensive community that makes up the United States. We all have individual rights and freedoms, but they come with responsibilities and consequences. There are 330 million people in our country. In order to live in peace and relative harmony with all these people, each of us voluntarily places some limits on our own freedoms. At times, we put the health of the larger community ahead of our personal needs. That's part of being a citizen in a democracy. For instance, as drivers, we all stop at stoplights and stop signs, and we count on everyone else to do that as well. Otherwise, we would have gridlock, accidents, injuries, and travel would be impossible. Many people are quick to declare their right to do something, but few talk about the limits to their rights. But a right, even one written in a constitution, should not be interpreted to give someone the freedom to do whatever they want, whenever they want. No right is an unfettered right, and all rights come with responsibilities. And in a democracy, an understanding that the free exercise of my rights should not interfere with your rights. That's the tricky part, and why we have rules and regulations and police departments and lawyers and courts, so that the law is applied as fairly as possible across all of our communities and life appears fair. Tonight, we were talking about guns and their place in a free society. 330 million people in our country, around a third of the adults, that's about 82 million, own over 400 million guns. That's a lot of guns, and the gun owners are vociferous about their right to own those guns. For them, gun ownership is seen as protection for themselves and their families, and many are genuinely fearful without that protection, and they want to carry them everywhere, concealed. It's a quality of life issue. There are 200 million other people in our country, 2/3, who are not gun owners, and many are uncomfortable with the excessive gun violence and death in our society and want to know where is their right to live without that violence and fear of being shot in the mall or a restaurant or a movie. They do not want to be fearful and do not want to carry a gun. For them, it is also a quality of life issue. There's a lot of misunderstanding between these definitions. To make our democracy stronger, we must talk about these issues surrounding guns so we can find some consensus and stop fighting each other. For some time, the League of Women Voters has been following gun issues and lobbying for safe gun laws. With the Newtown massacre of 20 little children and 6 teachers, shocked our whole community of Pittsburgh and Allegheny County into much angst and soul searching. The League wanted to try to understand such violence and how to combat it. We zeroed in on a process called Deliberative Democracy. To do this, we solicited volunteers from all aspects of life and positions on guns. All were given the same background material ahead of time. At each of several meetings around the county, participants were dispersed among multiple tables, each with a trained moderator and a scribe, and the same set of questions. Each question was considered for a set period of time. Someone from each table then reported on the results to the whole group. There were no right or wrong answers, just a sharing of ideas. And people listen to each other, promote understanding, and find commonalities. The gun issue has so many aspects to it, all complicated and requiring complex solutions. From our deliberative democracy events, we've identified several different but related constituencies that need to be involved. One, of course, are responsible gun owners. From our meetings, we acquired 2 gun enthusiasts to join our League Study Committee, mainly because, in their words, this is the first time we've been to any group about guns that didn't flatly blame all gun owners for the problems. The gun owners we had on our committee and others they introduced us to are not the people who are committing mass shootings. They are as appalled as the rest of us at the carnage, but they do not see this as their problem. They are using and storing their guns safely and do not want to be blamed for the extremely high gun deaths in our country. Large numbers of these responsible gun owners are thus unwilling to make any changes to their personal gun culture for something that is a remote problem to them. However, society will not be able to make much progress in reining in gun violence until these responsible gun owners acquire some ownership of this problem and are willing to work with non-gun owners to develop policies and form an approach that will protect their rights to gun ownership and the rights of everyone else to live freely and safely within our communities. This will require real commitment to finding a solution and a willingness to compromise on some things in order to promote a better quality for all. This conflict between 2 definitions of quality of life needs to be the topic at all sorts of community gatherings that include people of all viewpoints and encourage thoughtful, serious engagement on this issue. Keep your eyes on the prize, a free society where all people can live without fear of being indiscriminately shot at or killed by a gun accident. This is something that all of you can be involved in. Gather together, whatever your favorite groups are, to discuss the shared responsibility of all citizens to address these gun issues. And in your discussions, you'll be laying the groundwork for future meaningful public policies and projects designed to protect gun owners' rights to own a gun and non-gun owners' rights to be gun-free. You also have to talk about neighborhoods. When I was growing up, people had guns mainly for hunting, some target practice, skeet shooting, and they're mainly long guns. Guns were in the news mainly as a crime issue, and safe storage was not a public topic. Responsible gun owners often resist keeping their guns in locked storage. They don't want their guns in a safe because they feel the need to have them hand-in loaded in case they are challenged. Most feel their guns are safest when they're in their possession. No one recommends leaving a gun in one's car unless it is in a special locked and bolted down container. Today, most of these responsible gun owners say they have guns for protection for themselves and their family. These may be long guns or handguns, but because they are worried about personal protection, they usually are handguns that can be carried concealed. Concealed carry requires a permit in most states, although there is an effort in states with lax gun laws to allow anyone to carry concealed without a permit. Buildings can be posted with signs prohibiting guns inside, as many churches, schools, and businesses do, but these signs must be permanently displayed at the entrance so that everyone will see them when they come in. The League of Women Voters held one of our DD meetings in neighborhoods that regularly experienced high levels of violence and shootings. Deliberative democracy, that's what I was trying to get out. We anticipated that we would find a real desire to get rid of guns. What we got was a plea for two things that they said would improve the quality of life for their neighborhoods. First, the residents wanted a return to and an increase of community policing. They wanted the police to get out of their cars, walk the streets, get to know the residents and the local store owners and restaurants, and the general pattern of life in their community. They wanted to rebuild the trust that used to exist between law enforcement and neighborhoods. And they expected this would cut down on local people being misidentified as suspicious. The second thing they wanted was for the city to get rid of the empty lots and abandoned buildings that attracted drug and other criminal activity, because that was what brought the guns and violence into their neighborhoods. This is a thorny issue, as absentee landlords currently must be 3 years in arrears for back taxes before the city can take over the property. And if some of the owed taxes are paid in that time period, the clock resets at 0. This can go on for years, but it's grossly unfair to residents who want to live safely and peacefully in their neighborhood. This is a state issue, but surely one that both gun owners and non-gun owners can solve together. There's a place for real civic engagement on this issue for local citizens. Making your concern known to your elected officials, and if you're an attorney, volunteering to work on solving this problem. Getting rid of neglected and abandoned property is a benefit to the whole community. Another constituency is the suicides. Suicides account for over 60% of gun deaths annually. And here in the US and globally, and 80% of successful suicides are by gun. Dr. Rozel will speak more on this, but I want to add this. Many suicide attempts are impulsive, yet the crisis that leads to it is fleeting. If a gun is readily accessible, it will be used. But studies show that if the attempt is interrupted, often the moment passes and may not return. Such an interruption may only need to be going to find a key to unlock a gun safe and then find another key to unlock the ammunition. To combat suicide, some states have adopted the gun shop project, where gun shop employees are trained to encourage gun purchasers to include a sturdy gun safe and ammo safe at the time of gun sale. They distribute printed information, will explain to the buyer how important it is to have their guns locked away when they're not using them. This logic seems to work for most gun owners, and they do not feel threatened by this activity. This could be a project that we would like to adopt in Pennsylvania. It's very person intensive, but it could work. Next, we just discussed accidental shootings. Accidental shootings usually hover around 1,000 per year, but they're devastating for those that are involved. So often they're a result of a moment of carelessness or unsafe storage of guns, usually loaded, that are discovered by children. Responsible gun owners are sometimes not so responsible. I've had several parents tell me that they do not need to lock their guns away because they've put the fear of God into their children and they wouldn't dare pick one up. Generally, that's wishful thinking. Better to train your kids in the safe storage of all guns and ammunition and keep the key with you. Locally, organized public information campaigns emphasizing safe, locked storage of guns can influence a whole community to take stock of current practices and encourage individuals to improve their personal gun safety habits. Of course, there's the question of mass shootings. Nothing lists the question of community gun policies into the headlines like a terrifying mass shooting. It gets everyone's attention, even though it involves a small percentage of annual gun deaths. Suddenly, everyone feels vulnerable, as if a target were pinned on their backs. People clamor to have something done. The question is, what? These shootings are terrifying precisely because they are so unpredictable. What is the motivation? What kind of person does this? Where did they get the guns and ammo? How can we prevent this? The problem is there are no easy answers. It's usually about closing the barn door after the horse has already gone. What's surprising is the number of mindless shootings daily. They are only defined as mass shootings if 4 or more people are killed, but there were 693 of those in 2021, almost 2 per day. And such shootings have begun to rise during the pandemic. So the 2021's total was 13.4% higher than 2020, killing 702 and injuring 2,844. That's a lot of grieving friends and relatives. The injured are mostly ignored in media coverage, but the injuries from these shootings are often devastating, especially when the bullets used are the ones made to explode in the body and do maximum damage. And fundraisers after a mass shooting are usually for families of the dead, but not the wounded, who often never fully recover. So here's another opportunity to do something to improve the situation. There is no excuse for selling such bullets to anyone other than the military, and you might even want to reconsider that. These bullets are designed to remove troops from the battlefield. No one should be able to buy these bullets for civilian use. If you live in a peaceful society, you're not supposed to be killing people. And our responsible gun owners told us that no one would hunt with them, as the meat would be contaminated and inedible. Gather your friends together and lobby your state legislators and Congress to have such bullets banned from public sales. I know people don't like banning things, but some stuff just needs to be banned. And finally, we talked about homicides and other criminal activity. Guns used for criminal activity are some of the ones most difficult to find and track, primarily because criminals are usually, though not always, smart enough not to use a registered gun, although they may use somebody else's registered gun. This is the biggest complaint by responsible gun owners as to why they do not want to participate in programs that require gun registration. They are afraid their guns will be stolen or borrowed without their knowledge and used in a crime, and they will be implicated. Surely this is an occasional problem that can be solved by serious people of goodwill, and perhaps they can address why people own so many guns that they cannot keep track of them, and how gun storage laws and regulations might address this issue. Usually, the guns used in crimes exist outside of the legitimate gun culture. The easily available Saturday Night Special, and nowadays the ghost guns that are printed by laser printers. They're very hard to trace, but can be just as deadly and are increasingly found in high school student backpacks. This is a developing problem that needs to be watched. The easy accessibility of these guns can only be addressed with federal legislation. Strict gun laws will cut down on crimes involving guns within that state, but states next door with lax gun laws are a constant source of supply for criminal needs in other states. Responsible gun owners are not the purchasers of these guns, but they often prevent the laws and regulations that would help law enforcement track and interrupt the sales and use of such guns. This is another issue for your community discussions. How can we cut down the easy accessibility of these guns without making the responsible gun owner feel threatened? And when you have these discussions, include law enforcement. They're on your side and have unique professional and personal views on these issues. These are some of the major findings we found in our gun study here in the League of Women Voters of Greater Pittsburgh. Everyone knows the gun statistics everywhere in the US are horrendous. And after several years of decline, the statistics have started to climb again. That's unacceptable. Such a complicated topic, like all complicated issues, needs complex solutions. It's never just one thing, and there's no one law or policy or project that will solve all our problems with guns, but we need to learn to live together with guns in safety in a free society. I indicated several areas in which citizens could take things into their own hands and start the process of addressing gun violence and changing the dialogue. And our other two speakers will speak of other actions. But we are all at a disadvantage because our elected officials are unwilling to help for a variety of reasons, but primarily because their commitment is to get reelected. Support for easy access to guns appeals to voters, and gun owners can be single issue voters. Polls suggest that the great majority of citizens would rather promote the common good, a society that doesn't rely on weapons to promote peace and public safety. Thanks to gerrymandering and the filibuster, we continue to live under the tyranny of the minority on gun issues. We have a lot of work to do. Thanks for listening.
Thank you, Nancy. Thank you for that overview on deliberate democracy study, and brings to light how multifaceted this issue is. We're going to now we're going to hear the mental health aspect of this issue from Dr. Rozel. Dr. Rozel has been working in emergency mental health for more than 30 years and has been the medical director of Resolve Crisis Services of UPMC's Western Psychiatric Hospital since 2010. He is an associate professor of psychiatry and adjunct professor of law at the University of Pittsburgh. Dr. Rozel has served as an incident commander for mass shootings and has been involved in the behavioral health response to several casualty events. He has contributed to major policy and practice efforts, including the National Council for Behavioral Health 2019 report on mass violence, the National Suicide Prevention Lifelines Violence Management Guidelines, and the PA Governor's Special Counsel on Gun Violence report. Dr. Rozel is a member of the Mental Health and Justice Advisory Committee for the Pennsylvania's Commission on Crime and Delinquency. In conjunction with the PCCD, he is receiving funding from the Department of Homeland Security's Center for Prevention Programs and Partnerships to develop regional threat management partnerships in Western Pennsylvania. Welcome, Dr. Rozel.
Thank you. I'm going to share some slides because hopefully I'm unmuted now. I'm going to share some slides because, I'm a doctor, and in the modern era, doctors have a hard time talking to people without a slide deck to back them up. So I'm going to talk to you a little bit about sort of guns and firearm injury prevention and sort of the perspective from my academic clinical seat. Now, the other thing doctors like to do when they talk about stuff is we always begin with, conflicts of interest. Do we take money from drug companies? I don't. But, for disclaimer, I'll point out that early in COVID, while the kids were all doing remote schooling by their iPads, my daughter's first grade teacher said, "Hey, write a sentence with the word father on it and show it on the screen." Now, I'm board certified in child and forensic psychiatry. This is an amazing question, and I can only imagine the answers this teacher got or this teacher was trolling for. But this is what my daughter put up. My wife sent me that photo from home, and I saw that. I'm like, yeah, on brand. And the kid's getting some ice cream tonight. I was just nailed it, right? But for some philosophical conflicts of interest, let me go through a few things just so you understand who I am and sort of where I'm coming from, right? So the first thing I'll say is I don't donate to, and I don't receive payments or gifts from any of the, more partisan firearm policy groups at one end or the other. I am very actively involved in a group called the American Foundation for Firearm Injury Research and Medicine, which is part of the Aspen Institute and is a nonpartisan group, which is very interested in promoting objective research on firearm injury prevention. I also want to point out that some of you who in the North Hills might remember the shop Impacts, unfortunately closed down early in COVID. And actually, I used to work for them. The owner, one of the owners was a good friend of mine, and he said, "Jack, I'm really good at teaching my staff how to sell a gun, and I need someone to come in and teach them how not to sell a gun and how to recognize someone in crisis, on how to help that person with something that isn't a firearm." And I thought that was a pretty good idea, and I was really happy to help out with that. Well, I could not do my work without the support and the grace of my department at UPMC. I also want to be clear that I'm not speaking on behalf of UPMC or my academic department. All right. Well, from here on in, it gets a little bit less child safe, right? I learned in med school that gunshot wounds are tough to treat, and they take a terrible toll on the survivors and the bystanders. And I learned in law school that the Second Amendment is the Second Amendment is the Second Amendment. But I appreciate there's some nuance and there's some modifications to that over the years. And as someone who's been working in emergency mental health for most of my life now, who's worked with the survivors, the witnesses, the first responders, who've been around gun violence, having worked with so many kids and so many adults and so many families where the risk of suicide can become so immediate with that impulsive access to a firearm. I've learned that I'm pretty good at treating PTSD and recognizing PTSD in people who've been impacted by these events. And I've learned that I'm really tired of identifying and treating PTSD and want to find a way to prevent some of these terrible events from occurring, right? And I'm an academic, right? I'm a policy wonk guy, right? I like good science. I like good research. I like good evidence to guide my decisions. And so somewhere from these four things that sort of blended, how I approach firearm policy, right? I've had to learn for my own needs, for my own clinical work, how to understand firearm injuries and what causes them and what prevents them and what we can do to reduce it. I try to follow the science and appreciate the limitations of science. And I'm not a politician and I'm not especially politically savvy, but I appreciate that there are challenges of wrestling with an issue that's a public health issue, a constitutional law issue, something that's intensely political, politicized, and personal. I'd suggest that science brings us to a middle path, not out of an intent to be 50% from one side or the other, but because that's actually where the facts and the research takes us. And what I'll often say is that, no matter where you stand on the issue of firearms, if you talk to me about this topic long enough, I'm going to say something that's really going to piss you off. And then I'm going to have research to back it up that I'll be delighted to share with you, right? You can probably see if you're looking on the screen right now, I got books behind me. I got thumb drives filled with research. I'm always happy to share this stuff. And my contact and info is readily available, right? All right, so what's the burden of firearm violence in the United States? Well, Nancy spoke a little bit about mass shootings, and that's what garners so much of the intense affect and attention. And in 2020, the FBI said there were 40 incidents with 38 people who were killed and 126 injured. Another group called the Gun Violence Archive, which by the way is a really good nonpartisan group that just uses different methodology and different sources, said there were 611 incidents with 515 killed and 2,500 injured, right? And by the way, that's a lot, no matter how you measure it, no matter how we change the definition. But compared to the overall burden of gun violence, it's not that big, right? We have probably about 1,000 deaths by police shootings. We have about 500 accidental shooting deaths every year. We have 19,000 firearm homicides. It works out that about 75% of homicides in our country are firearm related. And the uptick we've had in homicides over the past few years is almost entirely firearms. Stabbings, strangulations, defenestrations. We have data on murder by defenestration. Those have all been level, but firearm homicides have gone up sharply over the past few years. And again, as Nancy noted, most of our firearm deaths are not homicides. They are suicides. The person who is most likely to die because of a firearm brought into the home for family safety, for individual safety, is the gun owner or someone in the family. And that's a terrible burden that we have to think about. And we have 130,000, maybe-ish, lots of caveats to this. The CDC is actually no longer reporting this data because they've had such measurement, right? A couple of things I want to extract from this. So first of all, say, again, most of our homicides are firearms. Just over half of our suicides are firearm. And if someone doesn't die from that initial suicidal behavior, generally they don't go on to a second type of behavior. So if I can keep them from a firearm for that first suicidal behavior, I have a far better chance of keeping them alive. Well, is it an American issue or is it like a global issue? Well, this is some data looking at firearm death rates across the economically developed countries. And what you can see here is the United States is the clear and unequivocal outlier. We have 25 times the firearm homicide rate, 50 times for males compared to other economically developed countries. We have 10 times the suicide rate. And by the way, we have pretty much the same violent video games and media that the other countries do. And Lord knows I'm the first to say that our mental health system has ample room for improvement. But it's not like we have a mental health system that's 10 times worse than other economically developed countries. And what we see is that 83% of all firearm deaths in the developed world, including 91% of females who are murdered by firearm and 98% of young children who are killed by guns, are Americans. This is a terrible burden for us, right? And to quote Surgeon General Satcher, from well over 25 years ago, right? If it's not a health problem, then why are all these people dying from it, right? And it's certainly a multifactorial problem, but I think it's very fair to look at firearms and their role in this serious burden of injury. And I'll point out that there was research that came out just earlier this week that said that deaths from firearms yield more loss of life in terms of years of lost life than any other cause of injury, including motor vehicle accidents in our country, right? So this is now shifted. But we have, by conservative estimates, 393 million, probably closer to 500 million firearms in civilian hands, more than the next 39 countries combined. If you believe the roadmap to reducing firearm injury in our country involves some kind of magical consensus in Washington, D.C. or Harrisburg that leads to all the guns going away, or if you believe that the pathway to reducing firearm injury in our country is more guns, less crime, and we're somehow going to get there when we get to 600 million guns, well, we need to have a conversation, because I got some questions, and you're going to have to help me understand your reasoning. And so we've got to figure out something else. One of the reasons why the US has a lot of guns is we are one of 3 countries in the world that has constitutional language talking about protection of firearm ownership rights. And in fact, our Constitution is probably the one that's most protective. And I know there's a question, I saw in the comments about that well-regulated militia language. It's an excellent question. But in 2008, the Supreme Court of the US in DC v. Heller said, hey, you know what? It's an individual right. Whatever this militia thing may be, the Second Amendment is about protecting your right and my right to have a gun in the home to keep ourselves safe. 2 years later in McDonald, they said, you know what, states have to follow the same rubric that we set down for the feds. And right now, I don't know when the decision's going to drop, but oral arguments were last October, and New York State Rifle and Pistol Association v. Bruin, which is nominally about sort of what are the standards that go into someone being able to get a concealed carry permit in the state of New York. This is a Pennsylvania one. But what's underneath it is really what's the judicial review standard for determining whether or not a law around firearm access is okay or not. And oh yeah, by the way, in the United States, in Pennsylvania, we have something called the 6120. It's part of the code, which basically limits local municipalities, counties or cities from putting in laws about firearms that are less than what the state's saying, right? So that's a big issue. And as recently as a week ago, one of the state superior courts upheld that, right? Well, I was part of the Special Council on Gun Violence, which was an effort to create consensus amongst a lot of different folks around firearms. And you can imagine that in our state, it was hard to get to a lot of consensus. Some of the things we clearly endorsed were things around education, things around promoting threat management. Some of the things we had a lot of debate about were things like universal background checks, laws for child access prevention or safer storage, but maybe some consensus on incentives, right? So maybe not a law that requires child access prevention, locks, et cetera, but maybe something that incentivizes, allows tax breaks, when you buy better storage devices, exploration of extreme risk protective orders, better data collection, better education for doctors like me, for gun owners, for gun dealers, and so forth, right? Because here's the reality, right? There's nothing about being a good man, woman, person with a gun that keeps you from getting depressed or PTSD, right? In fact, we know that we see very high rates of suicide in our veterans and our cops, and in some of the gun owners who may be the ones who might otherwise be most likely to use them in a self-defense setting. Well, how about research? Again, I said I like research. So there's a great report. It's a little bit of light reading here, 400 pages from the RAND Institute. You can Google it, RAND gun policy, and find a really great resource online. And they looked at about 13,000 research studies around firearms and then narrow down into the best of those studies. It came up with some best practice recommendations about what the evidence really says about reducing firearm injuries. For suicides, and again, as a psychiatrist, this is the big thing with the overall burden of firearm injuries. This is the big thing. What we know is that child access prevention laws, which we don't have in Pennsylvania, licensing or permit to purchase, which we don't have in Pennsylvania, minimum age requirements, which we don't have in Pennsylvania, or waiting periods, which we don't have in Pennsylvania, all appear to reduce firearm suicides. Lots of other stuff was studied, but the results were inconclusive. And also lots of stuff was studied, but the studies weren't of good enough quality. When you go to this RAND website, you get to a really nice sort of synthesized graph that you can see here. And what you see down the left here is all these different types of policy interventions. Again, child access prevention laws is up on top, has robust evidence that says it decreases unintentional injuries and deaths, and suicides has a huge impact on this. Waiting periods has some impact on violent crime and suicide. Prohibitions related to domestic violence has a big impact on violent crime. And you sort of get maybe a little bit of evidence for some of these other interventions. And we know stand your ground laws, which Pennsylvania does not have. We have castle doctrine, but not stand your ground laws. Those clearly increase violent crime, and you can sort of see through here. And when you actually go to the website, this is interactive. You click on any of these and it takes you to very nice summaries of these. The evidence is not complete, but the evidence is useful and gives us some good ideas. And oh, by the way, some really great research that's come out from a team at Hopkins has looked at a lot of different slices of the population and said, what do we know about who likes what types of policies and who doesn't like what type of policy, right? So permit to purchase. So this is the idea that someone might need to get a permit or clearance prior to going to purchase a firearm. We don't have this in Pennsylvania. We do instant checks. So that means you go to the gun shop and you give them your information and they enter it into a computer or they make a phone call. And I think the last time the state police released their data, like 97.5% of the time, there's an answer within a few minutes, about the time it takes to get your coffee at Starbucks in the morning, probably less. But we don't have that. We require that instant check. The permit to purchase seems to weed out more high-risk folks. Universal background checks, which we do not have in Pennsylvania, right? So if you want to transfer a handgun in Pennsylvania, by law, if you do it lawfully, not everyone does it lawfully, it has to go through a dealer or through the police where someone's doing a background check. But we can transfer a long arm, whether it's a single action hunting rifle that's been handed down in the family for however long, or whether it's a tricked out AR-15 with a high capacity magazine. We can transfer that cash money without a background check between private owners, and it's entirely legal. Child access prevention laws, again, widely supported by gun owners. Prohibition of purchase or ownership based on prior criminal offenses, including brandishing a firearm in a criminal manner and non-firearm violent offenses, actually widely supported, and we have some good evidence on that. Prohibiting ownership or purchase during a temporary restraining order for domestic violence. Again, I saw a question in the chat about, what about intimate partner violence? And we actually have really good research that whatever we can do to prevent abusers from having access to firearms can make a huge difference. Affirmative removal, when there's a restraining order, making sure that there's always a review of firearms when there's any kind of a domestic violence concern, can be a big issue. And I know that there's lots of people out there who will say that if only the victim of the domestic violence had access to a firearm, it would reduce it. The research quite simply does not back that up and indicates that a gun in the home increases the risk of violence.
You should go to bed.
And then you can see a few other things, including extreme risk protective orders, or proverbial red flag laws, also have very broad support, including among gun owners and in both political parties, right? Well, what do we do about this, right? So the reality is, like I said, I don't expect any radical changes in Harrisburg or DC anytime soon. Call me a cynic. I'm left with the reality that I'm going to go and I'm going to see a patient tomorrow morning. And odds are pretty good, probably 1 in 3 or 1 in 2 of these folks I meet with, there's going to be a gun in the home, right? And so the joke in psychiatry is How many psychiatrists does it take to change a light bulb? Only one, but the light bulb has to want to change, right? This is the joke about what we call motivational interviewing, right? So we talk to people about, hey, let's think of this as a habit change. We're not taking the gun away, right? But we're interested right here, right now, while you're struggling with depression, while your loved one is in crisis, while we're waiting for the medication to kick in to get you linked up with good therapy, while you are struggling with any of the legion of stressors that so many of us in our country are dealing with today. And 2022, after 2 years of pandemic and everything else, right? What do we do right here, right now, to make things just a little bit safer for you and for your family for the short term, right? And we go through a whole process of what have you thought about, what are you open to, what might work, and some of the common suggestions we come to. One, I'll highlight a really wonderful nonprofit called holdmyguns.org. It's run by Sarah Albrecht, who's I think a part-time doula and part-time range safety officer out in Eastern Pennsylvania. And she started this wonderful nonprofit to create a network of firearm dealers who are able to temporarily hold on to people's firearms when they're in crisis or someone in their family's in crisis. Sometimes people can store guns at work or a storage locker, maybe an appropriate friend or relative's home. Sometimes law enforcement agencies. Do be clear, not because Pittsburgh Bureau of Police has a policy that says they hold firearms for people, but because most of our jurisdictions are very small jurisdictions with, 4, 5, 8, 10 officers. And so, you know what? For Eddie, I've known Eddie since we were in middle school. Of course, I'll hold on to Eddie's firearm, right? These are officers who ideally, we talked about this idea of community-oriented policing. They know the community, and now we've added a responsible person to that circle of support for them. People can sell it. They can pawn it. There are buyback programs. Gun dealers, I've learned, actually really like to buy used guns. I think they explain they have a bit of a higher profit margin on that. There are websites like Arms List, which personally make me cringe, but they're lawful and they allow people to privately transfer firearms. And then safer storage at home. So kind of like we don't talk about safe sex anymore. We talk about safer sex. Anything can be reached in the home. I've seen any number of gun safes breached, but we can do it a little bit more safely, a little bit safer. So again, as Nancy mentioned, locked with the ammo stored and locked separately, sort of our gold standard aim. Locked safes, locked up with the key removed. But ultimately, especially as a doc, I would much rather have someone look me in the eye and say, you're an idiot, why would I ever want to get rid of my guns, than to have them smile at me and say, sure thing, we'll get rid of the guns, doc, and inside think he's an idiot, right? Because at least I can have an open conversation if I approach it respectfully and thoughtfully. Whereas if I just go in and say, you better get rid of all your firearms, young man, young lady, right? And do that judgy doctor thing, it doesn't go very well, unsurprisingly, right? Who of us ever went in to see our primary care doctor and said, what we really want to talk about is we want to feel judged by you, right? No one wants that, right? Turns off the entire process, right? So what's next, right? I'm more confident than ever that for whatever flaws it may have with the roadmap we laid out with the Special Counsel on Gun Violence is right, to aim at low-hanging fruit and achievable goals. To know that guns, violence, and firearm injuries will remain a serious public health problem in our country and in our state and commonwealth for the foreseeable future. Suicide remains a central concern, and suicide is easily ignored and easily stigmatized by our policymakers and our elected representatives without our voices and without our advocacy. I do not anticipate any major legislative changes from Harrisburg or DC in the foreseeable future, at least not in a direction that might, according to the science, reduce firearm injury. Right? But hope remains eternal, right? And frankly, I think there's a real possibility that the SCOTUS ruling about and the NYSERPA decision is actually going to broaden the court's ability to reduce firearm safety and to broaden access to firearms in potentially dangerous ways, right? So this is my contact information. I'll leave it up there for just a moment. I'm going to drop a whole bunch of links for folks into the chats. And I'll just close by saying this. There are some out there who suggest that firearm injury prevention isn't an issue for physicians, that we should stay in our lane. Our lane is with our patients. It always has been. It always will be. As long as people survive or not from shootings, as long as they live with the physical and psychological scars, as long as parents grieve the death of a child who accidentally or intentionally shot themselves, as long as suicidal impulses can be translated with near certain lethality because of access to a firearm, it will be our lane. But we are anti-gunshot wound. We are not anti-Second Amendment. The lane is broad and the need is tremendous. It will not be achieved without cooperation. And there are smart, responsible, lawful gun owners and gun dealers and creative and caring professionals across the spectrum who are as passionate about preventing these events as health professionals are. This is our lane, and we will move forward together for our patients and for our communities. Thank you.
Thank you, Dr. Rozel. Thanks for joining us, and thank you for the insight, the mental health and physician insight into this issue. And you talked a little bit about legislative policies, and so we're going to go to Hadley Haas, who is with Moms Demand Action, who's going to give us an overview of some of those legislative policies in Pennsylvania concerning guns and gun safety. Hadley Haas is the current co-leader for the Pittsburgh chapter of Moms Demand Action for Gun Sense in America. She served as elections co-leader in 2020 and legislative lead in 2021. Hadley lives with her husband and teenage sons in Glen Osborne. Please welcome Hadley Haas.
Thank you so much. And I think Preston is going to help me and show my slides here for me because I had some technical difficulties earlier today. Thank you so much, Preston. So yes, I am humbled and honored to be here tonight. It's difficult to follow Dr. Rozel. I was really inspired by the things he said. I learned a lot from the things he said. And as he said, this is a multifaceted program. I am a mom. I come to this as a mom. I first came to this movement following Parkland. And as a lot of us did, we were motivated by that unfathomable tragedy. And the more we got involved, the more you realize how complex this problem is. Going to the next slide, I'm just going to quickly give you an overview of Moms Demand and our organization, talk a little bit about some of the Pennsylvania statistics, which I think we can hit on quickly because I know we've talked a lot about that kind of thing. And there are really kind of three planks to the work that we're doing with Moms Demand Action right now. We're working with our community partners who are doing a lot of the violence intervention work on the ground. So I want to talk a little bit about that, talk again about what we're doing in the safe storage space, and then talk about legislation and elections. And those are really tied together. So going to the next slide. Moms Demand Action is a grassroots collection of volunteers. We like to say we're mothers and others because we're certainly not all women and not all moms, but we are all committed to ending gun violence. The organization was founded by Shannon Watts at her kitchen table as a Facebook group following the unfathomable tragedy at Sandy Hook Elementary in 2012. We previously had a Pittsburgh North and Pittsburgh Central chapter that kind of worked in partnership, but also did some things independently. And in late 2021, we combined our efforts. And that's when I stepped into this leadership role with my friend, Michelle Simon. And that's the link to our Moms Demand website at the bottom there. So just again, some high level statistics for Pennsylvania on the next slide. In an average year, 1,628 people die in Pennsylvania from gun violence and 3,058 are wounded. The rate of gun deaths increased by 23% from 2011 to 2020, and we know that's only going to continue to increase with all of the guns that were purchased during COVID. Gun violence costs the state $942 per person, which is $12 billion annually, and $567 million of that is paid by the taxpayers. As other speakers have said tonight, about 60% of those gun deaths are suicides and 38% are homicides. And I think, there were a few local stories that I think really illustrated recently how multifaceted this program was, or this problem is, and, really touched me. Marquise Campbell, as we've probably all heard, was the 15-year-old high school student who was shot in a van outside of his high school on the north side. My son is 15 years old. My sister works at a school on the north side. These all just hit so close to home. Connor Wolfe, who was only 5 years old, was a victim of an unintentional shooting. His older brother, who was 13, shot him in the family's home. Rachel Dowden was 28 when her estranged partner shot and killed her on the streets of Bellevue. And most recently, Christy Spacuzza, age 38, was killed while she was driving for Uber in Penn Hills. There are so many different ways that gun violence can affect us. And those are just three very moving stories. And I think we always want to remember the victims of these tragedies. All of the statistics on this slide came from everystat.org, which is another really good resource. It's easy to find some really important statistics. Moving on to the next slide. Again, one of the first of the three planks of the work that we're currently doing on the ground is lifting up and partnering with those in the community that are doing a lot of the work on the ground. We know that communities of color are disproportionately impacted by gun violence, and that every 11 minutes, a Black American is shot and wounded in the United States. And we're dedicated to acknowledging the experiences of gun violence survivors and amplifying their voices. So this is just a few of the amazing community partners that we have here in Pittsburgh who are working on these communities, or working in these communities that have been so affected by gun violence. So the South Pittsburgh Coalition for Peace, Reverend Eileen Smith over there has peace workers on the ground partnering with police officers to diffuse difficult situations, to help get mental health resources for children who are at risk, to work with families. The Neighborhood Resilience Project in the Hill District is focusing on trauma-informed community development and really trying to lift that community up through resilient healing and making that community more healthy. The HOOP Alliance, which stands for Helping Out Our People, is based in Woodland Hills. Kathy Welsh is a phenomenal mom there who lost her son to gun violence. And she is working with For Good Pittsburgh, which is Giselle Fetterman's organization, to run community programs for youth in the Woodland Hills area. The Wilkinsburg Sanctuary Project for Peace, Pastor Janet is leading the amazing efforts there in that community. Then there are organizations like Community and Family Builders that our friend Diane Powell has recently started. Diane was formerly and still involved with Black Women for Positive Change, but she shifted her focus a little bit and is really trying to do as much as she can for the youth and families in Woodland Hills and Penn Hills, and to get them mental health resources and help early to prevent gun violence. And then Mothers of Murdered Sons is being led by a woman who is such an inspiration. Her name is Tina Ford, and she's out of Clairton. Her son Amani was killed in 2019 in Clairton, and she's dedicated to honoring his legacy. She wants to help other mothers do the same, and so that the communities and people remember their sons as more than just victims of gun violence. So she's doing amazing things like paying for turkeys for 150 people in Clairton out of her own pocket. We're actually going to help her have a 50th birthday charity event in April to help her fund this year's turkey giveaway. She's also doing a Monologues program where she organizes an event to have mothers come and tell their son's stories or their children's stories. So there's just so much powerful work being done on the ground, and we want to amplify those voices and do everything we can to support those organizations. Moving to the next slide, we've talked a lot about safe storage tonight, and this is a space that we're really involved in as well. It is a public health issue. Gun violence is the leading cause of death among American children and teens. The same is true in Pennsylvania. It's not car accidents, it's gun violence. And we know that 70% of children under 10 know where their parents store their firearms at home. And we know, as Nancy and Dr. Rozel both said, that access to firearms triples the risk of suicide. So we have our Be Smart program, which is our public health program as part of Moms Demand Action. And that's an acronym that stands for Secure All Guns in Your Home and Vehicles, Model Responsible Behavior Around Guns, Ask about the presence of unsecured guns. And this is really about normalizing it, right? We've done a lot, I think, to normalize discussions around mental health. And how can we normalize these discussions about guns? You know, things like texting moms before play dates to say, hey, you know, my son doesn't have any allergies, but I just wanted to check in and see if you have any guns in your home. And if you do, I just want to make sure they're locked up and secure. And just trying to take the stigma away from conversations like that to help keep our kids safe. The R is for recognize the risks of teen suicide, and T is for tell your peers about Be Smart. So we are sharing this message via tabling and presentations, and we will go to school board meetings and talk to schools and community centers and really anywhere they'll let us in the door. We were recently at the auto show last weekend in downtown Pittsburgh, and we spent the weekend with our Allegheny police and community partners. So one Moms Demand Action volunteer was paired with a police officer throughout the weekend. We had 5,000 free cable gun locks to give away. We also had a lot of literature, and were able to talk to people about their guns at home and if their guns were stored safely, and make some important connections to share that information more broadly in the community. And that was a really valuable effort. And I think having that partnership between the police and Moms Demand Action enabled us to be more approachable for a lot of the people at the auto show. So as everybody has said already, firearms should be locked, unloaded, and stored separately from ammunition. We believe that absolutely. And we know that if we can keep guns out of the hands of our children, lives will be saved. So Be Smart for Kids is the website there at the bottom, besmartforkids.org. There's a lot of valuable resources and information there as well. And then moving on to the next slide, the third plank of objectives is our legislative work and elections work. So, and this is something Dr. Rozel touched on as well. We at Moms Demand Action are a nonpartisan organization, I should say, and we believe that common sense gun legislation should be a nonpartisan issue. The reality on the ground, especially here in Pennsylvania, is that the Republican Party has been very closely aligned with the gun lobby. So no gun violence prevention legislation has been brought to the floor, and we have seen a series of bad bills that have been brought to votes. So things like permitless concealed carry and punitive preemption, where municipalities could actually be sued for money if they try to enact legislation or rules that would keep their populations safe. Thankfully, we've had Governor Wolfe in place, and he's been our firewall. He has vetoed these bad bills, but it's reinforced for us how important it will be to have a governor in the coming session who is a gun sense advocate and believes in gun violence prevention. On the federal level, we have seen, it seemed like coming into the Biden administration that it would be a more friendly environment for gun violence prevention and common sense gun legislation. There was some momentum around universal background checks. There was some hope that Senator Toomey was going to help us strike a compromise and get something passed. That seems to have gone off the rails. The filibuster is certainly looming. I don't think Senator Toomey can get the votes he had hoped for, and so that has been languishing. There has been some more momentum for safe storage coming out of the terrible incident in Oxford, Michigan at the end of the year. And then there's another family, the Song family, that's been doing some really good work around this. They tragically lost their son, Ethan, to an unintentional shooting. He was playing with a gun, a loaded gun at his friend's house. They were recording videos for social media, and the gun went off and Ethan lost his life. And his mom, Kristen, has been traveling the country fighting for safe storage laws. And I know she had an audience with President Biden recently, and she has gotten laws passed in many states. Unfortunately, Pennsylvania has not been one of them, but there is some hope for that at the federal level. And there have been some steps taken at the executive level on ghost guns, and we're hoping for more here. These are untraceable guns, like Nancy mentioned, that are made using 3D printers or DIY kits. They don't have serial numbers, so they're not able to be tracked. A permit is not needed for them. And again, this is absolutely something where we should have bipartisan support. In fact, the police officer I was working with for 3 hours last Friday night at the auto show had told me he had come across a ghost gun and didn't know what it was at first, and tried to run it, realized there was no serial number, and just was dumbfounded that this was legal and that nothing was done to address this problem. So we're, really hopeful that at some point in time we can do something to address ghost guns. From a Moms Demand Action perspective, in terms of the legislative priorities, I think they look at some of that data that Dr. Rozel shared about what's most impactful. They also look at what might have support and be feasible, and then they try and focus our volunteers on what our best priorities should be. So this is kind of the current list. Again, ghost guns, safe storage, universal background checks, also funding for violence intervention programming. And we have seen more of that. I know Governor Wolfe just put a lot of money into violence intervention programs in Pennsylvania, but we want to make sure those programs are fully funded. Again, extreme risk protection orders, like Dr. Rozel mentioned, that allow families or police officers to petition to have a firearm removed from somebody who seems that they may be a risk to themselves or to others. And Dr. Rozel also mentioned permit to purchase, which is also a long-term priority for Moms Demand Action as well. And the data really supports that would make an impact. It's sort of background check plus, and seems unrealistic in the current environment, but really would be the gold standard in terms of helping make this country safer. So moving to the next slide, from an election standpoint, how we work at Moms Demand Action is we have a gun sense candidate of distinction program. So we have a survey that we distribute to all candidates running for election. At this time, we have 26 priority races in the state of Pennsylvania, including governor, lieutenant governor, and US Senate. Those candidates will be receiving surveys from Moms Demand Action. And then starting in early March, we'll have surveys to distribute to any candidate running for elected office. Those responses to those surveys will be evaluated, and then candidates will hear if they have been awarded the Gun Sense Candidate of Distinction. If you know of somebody running for office this year who you think would be a good Gun Sense candidate, you can let us know by using that email address there. It's pamomselections@gmail.com. And there's also more information about the Gun Sense candidate program at gunsensevoter.org. That URL is also there. So moving to the next slide, once we have our Gun Sense candidates, how will we support them? In a lot of the usual ways, we'll be out canvassing, I think, this year, now that COVID restrictions hopefully will be a little less stringent than they were last election cycle. We'll also be doing lit drops, which is the canvassing without knocking on the door. We'll be doing a lot of phone banking again, and this was a real focus in 2020. We were phone banking every Sunday for the presidential election, every Wednesday for a statewide election, and then multiple days in between. So we really were committed to do everything we could to elect those gun sense candidates. We'll have a series of kind of postcard party events and invite candidates in priority races to attend those events. We'll use our voices on social media to lift up the candidates where we can. We'll attend candidate events. We'll do anything that we can in order to try and get these gun sense candidates elected. So that's the information I had prepared for you today. I want to thank you all. We can go, whoops, I think I added this next slide maybe after, but if you're interested in joining Moms Demand Action, you can text the word READY, READY to 64433. You can download the Moms Demand Action app in the App Store. And then all those links I had on the last slide too, but we'll make sure to get them out to you as well. But thank you very much for your time. And, this is just such an important issue, and I appreciate it being a part of this discussion.
Thank you. Thank you, Hadley. I want to thank all of our panelists tonight for their insight. And we have a few questions from our attendees that I will just throw out to the panel, and whoever would like to answer. I guess we'll start with, just because Hadley just mentioned the ghost guns NPA. Someone did have a question if we have any update. Do you have any update on the ATF ruling on ghost gun legality?
I don't have an update
Okay.
on that right now. I can certainly look into it and get back to you. I don't, I know there was guidance. I don't think any real action has been taken yet, but I'll research that and get back to you.
Okay, great, thank you. Dr. Rozel mentioned that a lot of the things to prevent gun violence, we don't have the laws enacted in Pennsylvania. So somebody asked, how can we utilize laws that have already been enacted in our state? There are laws on the books for some gun control measures, but it doesn't seem that they are actually in place.
Nancy or Hadley, I don't know if you have any thoughts on that.
Can you read the question again, Chris?
They want to know if we are utilizing the laws that are enacted already in our state, and if they're making a difference, if you believe they're making a difference.
Go ahead.
I mean, I think they are. I think like anything, we could be more effective in enforcing some of these laws, but I know, the background checks that we do have, everything that we have in place is helping the cause. There are, and I don't have the numbers at my fingertips, but there are many people who have been stopped from purchasing a gun because of the background check process. So things like that, are important. And, I will sometimes hear people say like only, criminals don't follow laws, only law-abiding citizens do. But having laws on the books do help keep guns out of the hands of criminals. A lot of times guns are, taken and, anyway, I'll let Dr. Rozel add on to that as well.
Yeah, first of all, just to underscore what Hadley just said, like we want to make this libertarian argument of why should a safe, responsible gun owner face all these barriers and laws to accessing and using firearms when the criminals were going to break them anyhow. Well, it turns out that when we look nationally, when we look over time, when we add laws, we reduce firearm entries. And when we look at the laws we have in Pennsylvania, such as background checks to purchase or transfer handguns or something like that, then it turns out that we know that works. We know that's a really, really fast process the overwhelming majority of the time, it happens just within a few minutes. I don't think it's an unreasonable burden to say, let's extend that to long arms as well. So we have a few more safety measures there. As far as sort of the laws on the books and are they being enforced? In a lot of ways, Pennsylvania is really good about this. For example, if you do what we call, the line try, right? So you go into the firearms dealer and where it says, hey, do you have any, outstanding warrants for your arrest? And say, I think I'm going to check no on that. And they run it through the system. The state police says, oh, this person should not be trying to buy a firearm. Well, they aren't going to sell me the firearm right away. But then in Pennsylvania, the state police does a really good job of looking further and either investigating themselves or handing off to local law enforcement what they're going to do. We do have inconsistent enforcement and resistance to enforcing state gun laws as well as some federal gun laws in different jurisdictions. Some of you may be familiar with this concept of being a constitutional sheriff, which is almost a political ideology about how sheriffs may or may not choose to follow or enforce different laws. And we know that can make a real difference in who owns and accesses firearms. And that gets really concerning. I've seen law enforcement hand back firearms to people after involuntary commitments who were quite concerning and high risk of violence. In fact, law enforcement knew they'd been involuntarily committed because they committed them, but then they hand the guns back. And what then happens is that person gets their guns back. Now, legally, yeah, they do have, by the strict letter of the law, 60 days to hand them off themselves. But boy, wouldn't it be nice if those officers found some other way to transfer those firearms away for that person and help them get resale value or something else.
All right, thank you. Another question for Nancy. Might the League of Women Voters collaborate with teachers unions, PTAs, school administrators across the state for this vital effort?
Have we or will we?
Um,
What was it?
Yes, collaborate.
Either one. We're glad to work. We're glad to work with anyone who would like to, promote gun safety. There are so many different ways in which we can all contribute to this. We all need to work for it, but we certainly don't want guns in schools.
All right, thank you. What are your suggestions to keep young kids under 5 safe? For example, when visiting friends and family who we don't know whether there are guns in the home. When's the youngest age that's appropriate to talk about gun violence and gun safety to kids?
I laugh because I've got a little girl at home. She's 9 now, and when she was probably 3 or 4 or so, we started having a conversation like, "Hey, do you know what a gun is? Do you know what it looks like?" And then we had the conversation like, if you ever see a gun, you tell your friends to stay away from it and you shout as loud as you can for an adult to come. And you don't let anyone touch it. And if you do that, like mommy and daddy are taking you out for ice cream. And about 15 minutes later, she comes into my office at home and I'm working on a PowerPoint on firearm policy. And she points at the screen and says, gun, gun, gun. And then turns to me and says, can I have ice cream now? And I'm like, damn it, she's right. She got me. But having conversations early on and regularly talking to kids about, always assume that if it looks possibly like a gun, it's a gun and don't touch it, don't play with it. Having those conversations like, hey, Hadley, my little girl is so excited to come over and play with your kids. She's so curious, I've got to ask, are your firearms safely secured and stored in your home? I'd hate for her to get into something of yours. Including those awkward times around like holidays, Passover and Easter's coming up where you get, all the 18 sugared up nieces and nephews running around the house getting into trouble. And, can we make sure that those guns are out of the house or safely secured so that, a wonderful day doesn't become a terrible day?
Yeah. Anything you'd like to add, Hadley?
Yeah, I was going to say the same thing. I think texts for parents, we're so used to texting other parents. And I think, that is the easiest way to do it, in a really casual way, to ask about firearms being in a home and group it with other things that you might ask during the regular course of those types of conversations. And that way, it's not something that you're addressing directly with the child, but, handling with the parents as you do food allergies and so many other things. And then I think as ease into those conversations with the children as they feel more like they're ready to handle those conversations. But I think it's a tricky thing. And I think every child and their maturity level is different.
I just want to say that little children are so literal, and you can go through all kinds of instruction with them about, if you see a gun, and show them one or another, but they may, as soon as you've done that, they may walk in another room and see a different type of gun. And it's the lesson has been lost on that. You just cannot leave these things hang around. And too many people are so familiar with them in their own homes that you ask them if they have guns, and they'll say, oh no, because they've forgotten they've got, these things. So you can't be too careful.
There are a few firearm safety programs specifically designed for kids, including programs that have come out from some major firearm advocacy groups that have been researched and shown to be ineffective. Now, I happen to believe that education is generally a good thing, and it's a matter of trying to figure out how to get the education right. But it also makes sense that in the life of a growing, active, curious, forgetful child, a 30-minute talk with a teacher in a coloring book may not lead to residual lasting behavioral changes. So we've got to find out how to do it, because the reality is that we had a lot of homes with a lot of kids, and we know that 40% of homes with a kid in them are not storing their guns in the safe way that I would want them to be stored.
Absolutely. Thank you. That's very important. Yes. We mentioned before, and Dr. Rozel touched on it, a question about partner violence and gun violence. They asked, what do you suggest we can do as voters to change this? And another comment, has the domestic violence restraining order been shown to reduce intimate partner violence?
So I can start. I mean, I think this is, as voters, this is the tough question, right? So we can advocate to our elected officials for things like extreme risk protection orders, where firearms could be removed from somebody who's deemed to be a risk. There are some things, on the books, and that I made a note because I saw that in the chat box, and I know that was the one recent victory we had in 2018 was that piece of legislation, and I have not seen data on that. So I took that as a follow-up item to see if there's been any data on the effectiveness of that as well.
Nationally, we have good data that when we make domestic violence restraining orders with affirmative removal of the firearms, when we put that into law, it definitely impacts and protects victims of domestic violence. We've seen this over and over again. Domestic violence plus a gun, often, certainly not always, and not even necessarily majority of the time, but far more likely than domestic violence without a gun. But domestic violence plus a gun drastically increases the likelihood that someone's going to get murdered. And we know that the firearm murders of women are very different from sort of a sociologic and phenomenologic perspective than the firearm murders of men. And we're really almost pushing to say, we talk about homicide, and we also need to talk about femicide as having different causes and needing different interventions.
All right, thank you. And Dr. Rozel, you mentioned helping train those selling guns. Do you have any anecdotal data on this?
I'll certainly begin with my own experience. By and large, they like it. They seem to appreciate it. And we talk about lots of different things, not the least of which is, how to, as that person's coming in, some people come in and, they say, oh, I want the Sig Sauer M&P with the ceramic coating. And, they know exactly what they want. And some people come and say, gosh, I'm kind of new to this. This is kind of why I want a firearm. can you help me sort of figure out what the right one is? And those are things like that the retail folks know what to do with. It's the person who comes and says, I just need a gun, that, we start getting really worried about. Like, I'm not going to go into the shoe store and say, just give me a shoe. And I'm going to say, I want a wingtip, I need a trail shoe, something else, right? Some of the same kind of reasoning. One of my colleagues, Emmy Betts, who's an emergency med doc out in Colorado, has done a ton of work with gun dealers out there. There's great projects up in New England. We're trying to get a better network across in Pennsylvania. In fact, the National Shooting Sports Foundation provides a lot of great resources for dealers on suicide prevention for just those purposes. And the nonprofit I work with, a firm, was just at SHOT Show in Las Vegas, which is the big trade show for the firearms industry. And it looks like they made a lot of headway, a lot of very positive engagement there. So the community, many people in the community want to have these conversations. They do not want to turn on the evening news and say, damn it. Right? They don't want to pick up the newspaper and read an obituary and say, I remember him, right?
Yeah, there's a lot of people want to do, like Nancy said, we all need to get involved, and a lot of people do want to help out in some way. This will be the last question. Should more citizens sign up for gun safety training in order to familiarize themselves with what is taught and perhaps identify other areas to impact in order to improve stop gun violence? So I'm just assuming the person who asked the question may not be a gun owner. So would you advise all citizens to familiarize themselves?
Well, I really think that's probably a good idea. We actually, in our league committee, signed up to go get gun training, since one of our gun nut friends suggested we ought to go out and learn how to shoot a gun.
Firearm enthusiast friends.
It actually never came off because I forget why it was now, but they got involved in something we couldn't support, so we pulled out on that. But I was kind of looking forward to that, so I could actually speak with a little more authority about what it was like to actually hold a gun and shoot it and all that.
I did not grow up in a gun owning family or a gun owning community, but struck up a friendship when I was in residency with someone who was a firearms enthusiast, and she'd take me to the range, and I started learning a lot, and going to ranges and getting some training and working with some of the dealers and instructors to learn more. I've learned a ton. I'm not a gun owner. I have the privilege of living in a neighborhood where I don't need to own a gun. But I like learning about firearms and learning how to handle them. And I think if people are comfortable with it, there's a lot to be learned, even if it's the most simple thing of, if you see a gun and have to pick it up, how do you do it without pulling the trigger? A real simple skill that a lot of people get wrong.
Yeah. Anything to add, Hadley?
No, I don't think there's anything, to add. I think that there is something to be said for literacy with some of these things. And I know even when I was giving out the cable locks at the auto show the other day, people were asking me how to use them. And I'm not a gun owner. I'm not familiar with guns. And I thought that is something that I need to take away and become more familiar with. So I definitely think it's something that can't hurt. I don't know, in the scheme of all the things that it seems like we need to do in this space, if that would be top of my list, but I think it's something that could certainly be beneficial.
If you got to learn something, Stop the Bleed, and I'll put a link for that into the chat as well, is a really great group with great local leadership from some of our trauma surgeons at UPMC Presby. Just like we want to learn CPR, the Heimlich maneuver, how can we stop serious bleeding?
Wonderful, thank you. Thank you all to our panelists. And I just want to let people know, if you want copies of the slides from this evening's presentation, I put my email in the chat, program at lwvpgh.org, and I will send that to you. I've also saved the chat. If you don't save the chat and you would like all of the links in there, I can send that to you as well. To end this evening, I'm going to introduce Michelle Knoll, who is our advocacy chair for the League of Women Voters. Every meeting and event we have, we'd like to end with an action item for us to go as individual community members to make a difference on the issues that we discuss. So I'll turn it over to Michelle.
Thank you. I wanted to thank our speakers. This is very, very informative and illuminating. The action items that we talked about this evening were mentioned by our speakers, and one of them was holdmygun.org, which we don't have in this area, but it would be an action item to work for this in our area. And this could work for people in crises, and when you have, suppose you have a foster child in your home, or you have a house guest. These are all things that you could use holdmygun.org. It can be surrendering your gun and then getting it back after the crisis has passed. Another thing you could do is to start a gun shop project here by taking training or simply asking a gun shop owner if they've ever thought of simply asking their customers, how are you going to store this gun safely once you purchase it? And you could also join Moms Demand Action. Clearly you can work for a candidate and help them to be elected if they are a gun sense candidate. We want to thank all our speakers sincerely tonight for this very, very informative meeting, and thank you all for attending. Good night.